Hey YouTube, James Sane. So today we're going to be talking about blood products and blood transfusions. So a little bit about me. I've been a nurse for going on 40 years, a lot of various intensive care units, some industry experience, but I've really been in the cath lab for the last 15 years. We don't give a lot of blood products in the cath lab. I've never worked trauma. I've never worked surgical ICU. And so I've brought in Nicole. So today we're going to talk about blood. But what's your background?
I'm a medical laboratory scientist. So when your doctor says, "Hey, I'm going to order some tests. I'm going to go get your blood drawn, or give urine or anything," I'm that person that runs all those tests for your doctor.
All right, very good. So how many different blood types are there?
Four main blood types. If you don't get into the positive versus negative, so you have O, you have A, B, and then a combination AB. And then you can start getting into, am I AB positive? Am I AB negative?
So 4 blood types, and then each blood type can be positive or negative.
Right.
Okay, so when we talk about blood, we start talking a little bit about antigens and antibodies. So what's the difference between those two things?
Yeah, so blood really is separated into two components: your red blood cells, or your blood cells, and your plasma is what we really kind of consider it, and that's what contains all of your antibodies and everything. So your antigens are, I guess you can call them little markers on the cells. They act as flags and kind of identify them. So your A cell is going to have a little flag that says, "Hey, I'm an A." B, "Hey, I'm a B," and so
All right,
on.
so the plasma is basically what carries the red blood cells, and then the red blood cells have an antigen which is basically a marker that says I'm an A or I'm a B. What if it's an O? Is there an O antigens?
There is no O antigen. So
What does O mean? Well, somebody's blood type O. What does that mean?
Right. So what O is you can think of it as a zero. So 0 antigens. There's nothing on there. It's just a nice clean cell.
Okay. And then, so I think most people probably already know, like if you're A positive, obviously, well, I don't know if it's obvious, but you can get an A positive blood transfusion. If you're O negative, you can get an O negative transfusion. But there are some blood types that somebody is a universal recipient. They can get any kind of blood type, and somebody is a universal donor. Their blood can be given to any blood type. So can you help explain and understand the concept of why there's a universal donor, why there's a universal recipient?
Yeah, so the blood types, some of them are really rare. You're not gonna find a whole lot of people that have AB positive or anything like that. So it's really difficult for you to come into the hospital and they say, "Hey, I really need this blood type that only 4% of the population has." All right, well, now we got to try to go find it. So we want to have that flexibility to give blood, different kinds of blood to anybody. So you have your antigens, which really are the basis around what you can get. So an AB, a person that's AB has an A antigen and a B antigen. So what we don't want is a blood that has an antibody against A and against B. So what an antibody is going to do is it's going to, if you have an A antibody, it's going to search out that A antigen and basically destroy it.
So if you're AB, you can't have any antibodies against A or B. Okay, before you get into antibodies, let me ask you a question. So as a nurse, I have to send blood off to be type and cross-match. What does that mean?
So type, we're looking at what is the blood type, right? Are they AB? Are they O? Are they positive, negative, whatever? Cross-match, so we have the patient's blood, and then we have the blood that is going to be donated to them, and we put them together and see if they work. If there's a reaction, then we know there's going to be a reaction in the body, which is a really bad thing. We don't want that. So as long as there's no reaction between that patient's blood and the donor blood, then we're good.
Okay, so that's a good check. And every institution has different safeguards where it takes 2 nurses or So you have to check with your institution's policies as far as how you administer blood. But I'll put this chart up on the screen. So this is about like if you are O negative, you are a universal donor. You can donate blood to any blood type. And if you're AB positive, you can receive blood from any type. And then it gets into if you're OB positive, if you're O positive, you can get blood from just like 2 types. So what is this? How does this universal donor and universal recipient, how does that work?
So
if you would really be good, you want to be a recipient, you want to be AB positive.
You do.
If you're going to get in a car wreck or you need blood, you want to be AB positive.
Yeah.
So how does this universal donor and recipient work?
So it all stems from the antigens and the antibodies in somebody's blood. So a person, well, we'll start with the universal recipient, which is AB positive. They can get anything, right? So they have an A antigen, they have a B antigen. And because they have those antigens, they don't have the antibodies. So there's nothing in their serum or in their plasma that will destroy any of the antigens, right? So we give them anything, right? We can give them A because there's no antibody that will destroy that A. We can give them B. There's no antibody to destroy that B.
So that makes sense. So like if I was A positive, I can get A positive blood, but I can't get something that has an antibody against A positive.
So in universal recipient, AB positive, they don't have any antibodies. So they're not going to destroy anything you give them.
So the whole key is if you're receiving blood, you can't have an antibody against the type of blood you're getting.
Right.
All right, so you said AB positive was the universal recipient. So who's the universal donor?
The all-encompassing universal donor would be O negative. O negative can be given to anybody. So O, as we touched on previously, has no antigens on it at all. That's what the O is for. It denotes a negative antigen cell. So if they don't have any antigens, there's nothing there to destroy. So even if somebody has an antibody to A, well, there's no A there. You can't destroy something that's not there. Same thing with B. So that's why O can be given to anybody.
Okay, so this is talking about like packed cells, blood. Does the same thing apply to plasma?
The same principle does, but it's the complete opposite because we're talking about the other part of the blood.
Okay, well then that'd be a topic for another video. So we'll stop there. Hopefully this information is helpful if you have to give blood transfusions, and I'll put a link to, or I'll put the table up about who can receive what and who can donate what, because it can get confusing when you talk about the positives and the negatives and the different blood types and you haven't done it in a while. So anyway, if you like the channel, hit the thumbs up. It would help my channel. If you found the information helpful or useful, consider subscribing to the channel. And if you do, remember to turn on notifications so that you don't miss when the next video comes out. All right, guys, thanks so much. We'll see you in the next video.